So, hello everyone. Thank you for attending today's educational session with Dr. Laura von Hagen. Laura is a dedicated naturopathic doctor, and she specializes in hormonal health and fertility optimization. She is also passionate about supporting individuals and couples on their fertility journeys, using evidence-based naturopathic approaches to improve reproductive health. And today we are lucky to have her as our expert, and she'll be presenting on the topic of naturopathic medicine and how naturopathic medicine can optimize your fertility. So following the presentation, we will have a question period. So if you would like to unmute your mic, or if you would like to leave your questions in the chat, whatever makes you feel comfortable. And yes, so I will leave it to Laura and we can start.
Perfect. Okay, I'm just gonna make sure I have my slides up and ready to go. Thanks so much for that lovely introduction, Michelle. Yeah, like I say, we'll have a Q&A at the end. So that can be a good time to raise your hand. Otherwise, if something comes up and you don't want to forget your question while I'm presenting, feel free to throw it in the chat and I'll make sure I get to all the questions. So I'm just gonna share here. And then I'm just going to change this to slideshow. Good. So now you should hopefully all be able to see my slides. Can you give me a thumbs up, Michelle? Okay, perfect. So I'm going to be talking about how naturopathic medicine can help optimize your fertility. And I'm going to be talking about egg quality, but keep in mind when we're talking about egg quality that a lot of these things are going to also relate to sperm quality. I just didn't have enough time in this presentation to talk about both, so I wanted to present the data specifically on egg quality. However, things that we're doing to promote egg quality are also going to support sperm quality. And this is important because if you're in your fertility journey, you might already be aware that things like AMH, your count, your ovarian reserve, or AFC, your antral follicle count, those tell us about the quantity of eggs you have, but they don't tell us about the quality of eggs. We don't really know unless we do IVF. That's really a diagnostic tool. So we want to support our egg quality as best we can for anyone's trying to conceive. And we can do that through lifestyle and strategic nutrition, which is what we do best as naturopathic doctors. So just a little bit about me. I have a doctor of naturopathy from CCNM. I started treating fertility patients back in 2016 when I was an intern on the fertility focus shift. So I've been in practice for almost 10 years now. I also have my book, My PCOS Pregnancy, Your Guide to Getting and Staying Pregnant with PCOS. It's a really, step-by-step guide on everything you can do if you have PCOS to help you get pregnant and stay pregnant. Myself, I actually went through IVF back in 2020, so in the middle of the COVID pandemic, which was interesting. And I have 2 boys through IVF, so I've been there, I've lived it, and I know just how stressful IVF can be. And I currently practice in Ontario, where I see patients virtually and in person. I'm at Higher Health Center, and then I also work at Pollen Fertility, which is one of the fertility clinics located in Toronto. So preconceptions of care sets the stage for a healthy pregnancy. Everything we're doing now is going to help you be pregnant, but also have a healthy pregnancy and healthy baby. So I know it can seem like a lot sometimes, but I always remind people, health is a journey, it never ends. And everything you're doing now is going to pay dividends moving forward for baby and, throughout their life. So I know that it can be difficult, but remember that, what you're doing this for and how long it can have an impact. So we're going to talk a little bit about egg quality and things that affect it. We're going to talk about some supplements for egg quality because I know this is always a hot topic. I can't make any specific recommendations or treatment advice in this presentation, so it will be a general overview and for educational purposes. And then substance to avoid. There's a lot of myths out there on egg quality. I see some really strange things, some TikTok, Instagram, and it's a bit of the wild, wild west. So I kind of want to lay the groundwork on what you actually need to know and what's going to make a difference. So let's get started. So it starts with, like I say, the egg and the sperm. We can't forget about our friend the sperm. It takes two in a uterus to make a baby, but we're going to think about things that we want to do. We know that it takes about 90 days for sperm and egg to fully mature, meaning that the egg that you're ovulating this month was starting to grow 3 months ago. So 3 months prior to planning on trying to conceive is when we want to start optimizing egg and sperm quality. Then we think about conception. This is when we want to be also running blood work to check for nutrient status, early pregnancy care, and pregnancy and postpartum, right? So everything we're doing in that preconception period is going to have impact on us beyond that. So you're in the right place. You've all come here through Fertility Friends Foundation. You know, you're planning to conceive, trying, you're prepping for an IVF cycle, most likely. Maybe you're tired of Dr. Google giving you, wrong information. Maybe you've previously had a failed cycle and you want to try something different to optimize your chances. So, what impacts egg quality? And I want to bring this up because very often people just hear over and over again age, 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 age. I feel like that's a big one. And people will come to me and say, I had an appointment and all they kept talking about was my age. But as you can see, there's actually quite a few things that impact egg quality. And the wonderful thing is that a lot of these are what we call modifiable risk factors, meaning we can make a difference. So diet, your body weight, how much you exercise, your stress levels, your sleep, all of that we can work on together, and that will have a beneficial impact on egg quality. Some of these things we can't change, pre-existing conditions, maybe there's a genetic disposition there. Your genes are what you're given, but we can also change the genes in terms of our environment. That's the role of epigenetics. So how our environment shapes our genes. So even though maybe you were dealt a bad deck of cards that month in terms of your genetics, there are things that we can do to optimize. And this is where we are really the experts in this, whereas fertility doctors are more the experts in your IVF cycle and your medication. So remember this good old mitochondria. If we think back to the cell, it really comes down to mitochondrial health. And when we think about egg quality, it's not actually a lack of mitochondria. It's just that the batteries are kind of drained. So if you can think of like a flashlight where its batteries have died, we have to recharge the batteries and we have to recharge the mitochondria. So we need to give those cells, well, the egg, energy to grow and divide and implant. It's a very energy, dense process. And by supporting mitochondrial health, we're going to recharge those batteries and we're going to help that embryo implant and continue to grow. So here's some interesting facts that I wanted to bring forward. Sleep, because this is often the last thing, right? It's so easy as humans to delay sleep, even though we're really the only species in the world that like purposely delay sleep. If any other animal is tired, they just go to bed, but we don't like to do that. And we actually see that higher levels of melatonin have been correlated with higher levels of progesterone, which we'll get to this, but part of the reason why we use melatonin when treating fertility because of its impact on progesterone and helping support that luteal phase. One study actually found a linear relationship between total sleep time and the number of oocytes retrieved, so the number of eggs retrieved. And compared to women who slept 7 to 8 hours a night, those who slept less than 7 hours had a decreased number of retrieved and mature oocytes. And what we see too is that, anxiety during an IVF cycle is significantly correlated with diminished sleep quality. And now that's, not something that we wouldn't expect, right? When you're anxious, it makes it hard to sleep. So working through strategies to help manage your anxiety, to help manage your stress, setting good sleep hygiene, supplements that can help with with your sleep that are safe during IVF. These are all things that we can look at. But we do see it is that sweet spot of kind of 7 to 8 hours. And I know sometimes 8 can be really hard for patients. And I try to give treatment plans that I feel like I could stick to. I want to be realistic. So if you can't get 8, 7 is still great. Let's aim for 7 and go to bed and get a good night's sleep. Now, what about exercise? This is probably the one that frankly has the most misinformation online. I see so much bad information about exercise, and it really makes me sad because exercise is so important and it can be so beneficial. A lot of people are scared. What about cortisol? What about my stress? What type of exercise should I do? Can I exercise if I'm pregnant? And actually, the answer is it's pretty hard to overdo it. Um, Maybe in my lifetime, I can think of a few instances where I've had to have patients decrease the amount of exercise. But the majority of the time, we want you exercising. We want you to continue exercising while pregnant. And HIIT is absolutely safe. I know there's a lot of social media saying, well, HIIT, so high intensity interval training, is going to raise your cortisol. Yes, that's true. It's going to raise your cortisol while you're exercising, which is what we want it to do. And then it's going to come back down when you stop exercising. So that's very different than chronic stress where your cortisol is constantly elevated. So HIIT is absolutely okay to do if you like it. But if you like yoga, do yoga, right? The most important thing is picking something and sticking with it. So what do we see? So following IVF with ICSI, pregnancy rates and live birth rates are significantly higher in women who exercise and no difference in miscarriage. And this is important because often people are scared to exercise because they're worried about miscarriage, but we don't actually see that exercise is correlated with miscarriage. And in fact, people who continue to exercise have better live birth rates without any increase in miscarriage. What we do see is excessive strenuous exercise is associated with decreased live birth rates, regardless of BMI, so whether or not you're normal or underweight. But the definition of excessive strenuous exercise is like 5 or more hours of intense exercise a week. So this would be like if you're going to F45 every single morning at 5 a.m., maybe not the best thing to do while you're trying to conceive, but doing 30 minutes of weights, a yoga class, going for a light run, totally okay. So we just want to kind of find that sweet spot with exercise. Exercise is going to help promote oxygen-rich blood flow to the pelvic organs, which improves egg quality and also assists with implantation. So this is where exercise can be beneficial. Where you would need to be careful with exercise is during IVF when you're on your medications because your ovaries are going to swell. And we want to avoid twisting motions because of the risk of ovarian torsion. And then after an embryo transfer during the 2-week wait, typically we want people taking it pretty easy. So no running, no heavy lifting over 25 pounds, no strenuous exercise. So you can still go about your day. And that's usually when I tell patients just focus on walking. That's also going to be great for stress relief, but otherwise you can continue to exercise. Exercise during pregnancy, as I said, this one is hard because a lot of people are scared, especially if they've had a miscarriage in the past. And in those cases, then I'll tell them, you know what, let's take it easy so you get to that 12-week mark, right? We don't want any guilt in the first trimester. So take it easy, do what you need to do. And then when you start to feel more confident in your pregnancy, that's when we want to get 150 minutes of moderate intensity exercise per week. And moderate intensity, we want to do the talk test. So that means you can hold a conversation, but not sing your favorite song when working out. That's how we can gauge that it's moderate intensity. So exercise is still beneficial. And in low risk IVF pregnancies, exercise significantly decreased the risk of preeclampsia and gestational diabetes. So unless you've been told by your medical provider that's unsafe to exercise in pregnancy, even if you undergo IVF, you can still exercise and it will reduce your risk of pregnancy related complications. So I want to talk a little bit about nutrition. And this is just going to be a snapshot of kind of some things that we want to focus on. I find a lot in fertility, we hear about all the things we can't do. Don't eat this, don't eat that, don't do that, right? And it's often like a lot of the joy has been taken out of your life. So I try to look at nutrition more from an abundance and think about what nutrients could we include to help optimize fertility. So vitamin D, which can be taken in a supplement form, but we can also get it in food. So it's an anti-inflammatory fat-soluble vitamin, and vitamin D actually acts like a hormone in our body. And the prevalence of deficiency we see is actually higher in women diagnosed with infertility. And deficiency is also associated with decreased morphology and motility. Vitamin D, for one of for me, it's like personally one of those, like, you have to test. Like, it is a test. Don't guess. It's a non-negotiable when working with my patients because I don't know how much vitamin D you need unless we actually run it. I can't look at you and decide. And anything over 2,500 IUs in Ontario is considered a prescription. So if we do need to give you high dose because you're likely deficient, we need to have your blood work. Adequate vitamin D levels. So if using the Canadian units above 75 have been shown to reduce the risk of miscarriage, and higher levels are linked to improved IVF outcomes and implantation rates. Also interesting, vitamin D and AMH. So AMH levels can vary seasonally and can decrease by up to 18% in the winter. So I know we often will say to patients, we can't do much to change your AMH, and that is true. So AMH, which measures your ovarian reserve, it is pretty stable. But certainly if you are vitamin D deficient and we get you to sufficiency, because vitamin D plays a role in follicle development, we might see that we are able to, marginally raise your AMH levels. So as I say, how much to take? Test, don't guess. And here are some good food sources. So fatty fish, egg yolks, any sort of dairy, a fortified plant milk where they've added vitamin D, tofu, and then sunshine. It's always a tricky one because you also want to be cautious and wear your sunscreen when you're outside. But even like 20 minutes of going for a walk can be beneficial to help with vitamin D levels. So still wear your sunscreen when you're outside, but get outside in nature, get out for a walk, and that will also help with vitamin D. Now, fiber does more than just keep you regular. So I want to talk about why I love fiber and what it can do for fertility. Now, one of the common things I see is patients will come in to my office and been told if they struggle with infertility, they should go gluten-free. There really isn't a lot of great data on eating gluten-free. There are maybe some certain instances where we might want to avoid gluten, but for the most part, the majority of individuals, unless they have known celiac disease or they feel like they have a gluten sensitivity, they can continue to eat gluten. And this is because a lot of gluten-free products are really low in fiber. And what we actually want is eating more whole grains. So like a whole grain bread, a sourdough rye, for instance, because that higher intake of whole grains, likely due to the fiber content, is actually associated with increased endometrial thickness, with thicker uterine lining, and better live birth rates with IVF. Whole grain consumption has a positive impact on the vaginal microbiome because of that fiber and how it kind of feeds our gut bacteria. And then that in this way can also help support the vaginal microbiome, which we now know has a role to play in implantation. And then higher fruit and veg intake pre-IVF increases live birth rate. So we're looking at 2+ servings per day. So this could be some blueberries with breakfast, an apple with lunch, and then maybe having some carrots as a snack and a big salad with dinner. So if you feel like, fruits and vegetables are not something that are your friend, we can get them to be your friend, but we can start small and slowly work them into your diet and find a way that works for you. So the recommendation is at least 25 to 35 grams per day. This depends on your age and your body weight. As I will say, most of us as Canadians are deficient. It's hard to get there, and we want to focus on getting it from our fruits and vegetables and our whole grains because those are staples in a Mediterranean diet, and we want that kind of whole food style of eating anyways. So if you're unsure of how much fiber you're getting, you can actually track it using something like a MyFitnessPal app. And that's a great way to see where you're currently at and then, think about what we can do to increase your fiber levels. Iron, also very important during preconception and the pregnancy period. And because we want you going into pregnancy with good iron stores, because anemia can actually be a risk factor for premature birth, low birth weight, and postpartum depression. And we want at least 30 milligrams in a prenatal, although a lot of times women will require more. And when diagnosing iron deficiency, it can be helpful to run a full iron panel. So we don't just want to look at the CBC, but we might want to also look at ferritin, your iron stores, and then your iron and the other things like iron binding capacity. Iron, interestingly enough, I don't have great data on this, just more of observed, some women who are anemic have a hard time getting their uterine lining to thicken appropriately. I've seen that over and over in practice, and I know some other acupuncturists I work with who have seen the same thing, where it's always our anemic patients who have that thin uterine lining, and getting their iron levels up, getting that oxygen, getting that blood flow, because the iron is what carries the oxygen, was able to get them to have success with their embryo transfer. So I like to run iron similar to vitamin D just to get a snapshot of what's going on. So iron, we can take it as a supplement, although iron salts tend to commonly cause constipation. A lot of people don't like taking their iron pill because it causes that gastric irritation and can lead to constipation. Whereas iron bisglycinate, this is often marketed as gentle iron, it seems to be better absorbed and cause fewer side effects. And this is because you have a higher dose of the elemental iron. So 25 milligrams is as effective as 50 milligrams of ferrous sulfate. So essentially, you can take a lower dose to get the same amount, which then you have often fewer side effects. So if patients know they don't do well on an iron supplement, this might be playing around with their supplements, trying different brands, different forms, different dosing strategies, so that we can get you to take it, but not have all the side effects. So food sources of iron, yes, it's going to be better from heme, meaning animal sources, but you can also get non-heme in a lot of other healthy plant-based sources. So depending on your dietary preferences, we can find ways to increase your iron. So then miscellaneous factors. We talked a little bit about at the beginning how we're going to talk about substances to avoid. And I will say I try to kind of put certain things in a, an eat more often or eat less often category. But certainly if we're thinking about everything we can do to improve implantation, and specifically those with a history of recurrent loss, if we're trying to reduce your risk of miscarriage, there's some things we want to focus on. So eliminating caffeine or really lowering. So any amount above 200 milligrams in some studies increases risk of miscarriage. And I will say this is, again, very mixed. Some studies show much higher levels, some show lower, probably because of genetically how people, whether or not they're fast or slow metabolizers of caffeine. But 200 milligrams is about a small cup of coffee. So I say one and done. One small cup of coffee or tea, nothing more than that. But also if it makes you nervous, then just switch to decaf during this time, or a cup of green tea because it's much lower in caffeine. Eliminate alcohol. So definitely if you're prepping for IVF, we know couples who drink the month prior to IVF have poor outcomes. So if you know that you're going to be planning for an egg retrieval or transfer, we want to cut alcohol out of the life for both you and the partner. Cold breakfast cereal. I know you're probably thinking, what? Where did this come from? They did a big study on this, women's health study, and they looked at foods associated with miscarriage, and the only one that came back was cold breakfast cereal. And I think that's because if we think about a lot of breakfast cereals on the market, they're sort of that like carbs, right? Like it's an ultra processed food, it's high in carbohydrates, it's low in fiber, it's easy to overconsume if I'm thinking about like our Fruit Loops, our Honey Nut Cheerios, that kind of thing. So if you have a little, maybe you love all brand and that keeps you regular every day, that's probably not an issue, but it's more about maybe switching that bowl of Fruit Loops for a bowl of steel cut oats so that we get better absorption, less of a glucose spike, and more fiber. Choline-rich foods, these are my favorite to help with egg quality and helping reduce risk of miscarriage. So we can get those in eggs, salmon, and quinoa. So I often really liberal with my egg consumption with patients. We want to decrease trans fats. So again, this comes in a lot of processed foods. So chips, bakery products, margarine, shortening, that kind of stuff. And then any of our kind of quick carbs that can spike our blood sugar. So our juices, our refined carbs, our puff candy, and reaching for more of those whole grains. Now, BMI and fertility, I want to bring this up because it is one of those things where you hear so much misinformation about it. And what I will say is that BMI is not a perfect science, right? When we're measuring body weight, it's just a measure of gravity. That's all it is. It's the pull of gravity. And it's not telling anything about your body composition, your fat mass, your muscle mass, right? And so in the perfect world, we would also be looking at all of those things because I think that really important if we're working on building that muscle. And I try not to get patients to focus on the scale, and instead focus on overall health. So I realize it's not perfect, but we do know that we do want to ideally keep patients within that sweet spot of a normal range of BMI, because too high or too low can have implications. So we want to try and optimize health by keeping a normal BMI. What we see is with a higher BMI, there's increased inflammatory markers in the body. So it's actually increased cytokines, and that because that adipose tissue, that fatty tissue, releases those inflammatory markers. So patients with a higher BMI often have higher levels of inflammation, and we want to try and lower that inflammation to help support implantation and clinical pregnancy as well. We see higher rates of anovulatory cycles because those high levels of adipose tissue disrupt regular hormone functioning. So if patients have a PCOS, even a weight loss of 5 to 10% of total body weight can restore regular ovulation, which we would need to conceive. And we see a negative correlation between a higher BMI and AMH. So normal is 18.5 to 25, and you can calculate this online. And as I say, it's not perfect, but it gives us a good indication of the range we want to be. On the other hand, a low BMI and low body fat can prevent ovulation. If you don't have enough adequate body fat stores, the body's like, what's going on? Are we in a famine? Like, where's my next meal? There's just too much stress going on. I'm just going to shut down reproduction. This is not a time to bring a baby into the world, and this is not like an essential organ. So we do know that around 22% body fat is approximately needed to maintain a woman's reproductive ability. So if you're suddenly skipping periods or have irregular cycles, you want to start tracking your cycle and speak to your doctor about getting blood work, because we could look at blood work to see what's going on with your hormones. Last, I'm going to talk a little bit here about supplements. And as I say, this is just going to be a general overview. Depending on your needs, you might need something different, dosages, different form, different time of day. And so this is not meant to be for everyone to take, but I think it's good to know, like, if you were to take a few things, what are the things to really focus on? Now, omega-3s, this comes up over and over again in the literature, and not just necessarily supplementing with it, but also dietary intake. So if patients are, unless they're following a strict plant-based diet, increasing fish in the diet, fish and seafood, is always a good place to start. And what we see is higher intake of EPA and DHA, so those are our essential omega-3s, is associated with improved IVF and better embryos. Omega-3s also help support healthy blood flow, and they're important for uterine lining and implantation. So omega-3s at high doses, they're almost like a blood thinner, and they're also very anti-inflammatory at that point. But we have tracked this, where there was one good study where they were giving omega-3 and then alongside with vitamin E, and women who took the omega-3 had a better uterine lining thickness. So if patients are struggling with a thin uterine lining and they're having canceled cycles, we can look at supporting their omega-3s. That sources, everyone knows, salmon, trout, mackerel, so our fatty fish. But we can also get a little bit from grass-fed beef. There's also some plant sources, but most of the time we also need to add in a fish oil supplement in order to get to an adequate level that we would want. CoQ10 and PQQ. So CoQ10 is kind of like the one that everyone knows about for fertility, because it's concentrated in the mitochondria. So it's part of that like ATP shuttle. So it's helping with energy. Dosages can vary widely. I will say the average dose based on most studies and what most fertility clinics want is around 600 milligrams per day. But as I say, it really depends on your unique case. Now, you can get CoQ10 in two forms. One is called ubiquinol and one is ubiquinone. Ubiquinol is the quote unquote active form, but it's also very expensive and it's also very unstable. So I see sometimes videos people are saying, oh, you have to take ubiquinol. That's really not true. Most of the studies out there are using ubiquinone. They're just using CoQ10. Ubiquinone is also more stable. And when it is in the body, it will kind of flip-flop back and forth between both forms. So I tend to prefer the ubiquinone because also from a cost perspective, it's much better for patients. It is best taken with food because it needs to be absorbed with fat. And I will often use this with something called PQQ, where they kind of work synergistically to increase mitochondrial activity and efficiency. PQQ is another antioxidant. And we'll often see it combined with DHEA in women with diminished ovarian reserve. Now, DHEA is not something I can personally prescribe, at least here in Ontario. That would have to be prescribed by a fertility specialist. But you could take these together for 3 months leading up to IVF to help support egg quality. So, what do we know about taking CoQ10 before an egg retrieval? It's going to improve medication response. It's going to increase antral follicle count. We tend to see higher quality embryos and decrease cancellation. And we think it can potentially decrease fetal aneuploidy rates, which means if you end up doing PGT testing, where we're testing the embryos to see if they're genetically normal, we think CoQ10 can help with that formation of a genetically correct embryo. And we might see lower rates of aneuploidy, meaning you have more euploid embryos to transfer. This is all very new research, which is why I say potentially, because we're still figuring this out. At this time, there's a trend towards higher clinical pregnancy rates and live birth rates, but hasn't reached statistical significance yet. So this is the tricky part with research and fertility. We see that we get better quality embryos. Whether or not this actually translates into live birth rates, which is what we care about, we're not there yet. But we also just don't tend to run those studies because they're so expensive. So that's why we still recommend giving CoQ10, but we don't know how much it's going to change the whole outcome yet. We need more data in this area. Melatonin, as I said earlier, it's very funny because people will ask me, why did you give me melatonin? My sleep is great. But melatonin is actually a great antioxidant and has really good data on supporting egg quality and also improving clinical pregnancy rates because it protects against oxidative damage. And melatonin is actually concentrated in the follicular fluid in the ovaries. The dosages can vary widely. So when we're thinking lower doses, like 1 to 3 milligrams, that's more for egg quality. 10 milligrams can be more from actually helping with things like endometriosis and pain. So we can use melatonin at high doses from like a pain management perspective. It is one that I see a lot of adverse side effects from. So vivid dreams or feeling groggy. Often this is one where people are taking the wrong dose or the wrong form, the wrong time of day, too high a dose. So this is one that you would want to speak to an expert with to make sure that you're taking it appropriately to reduce risk of side effects. As I said earlier, melatonin can actually increase progesterone levels. So women who maybe have a short luteal phase, so a short second half of their cycle, it can help support progesterone. It decreases pain with endometriosis. And we think it can also help with placental growth and implantation, reducing risk of miscarriage. So if we're trying to help with endometrial receptivity and supporting implantation, we can use melatonin. And that's everything. So I was like, I think I'm coming near the end, but I couldn't remember. So thank you so much for joining me this evening. It's always a pleasure to support Fertility Friends Foundation and all the wonderful work that they do. If you want to connect with me one-on-one, I'd invite you to reach out to me. So you can check out my website. I actually just posted a really great blog on naturopathic medicine and fertility. So the 5 things we can do to support you. As I say, I'm at Pollen Fertility. If you're a patient there, you can connect with me, or I have my private practice, Higher Health, where I see patients across Ontario. If you have questions you're not comfortable asking tonight, you can email them, or you can follow me along on Instagram for more great tips. But I'll turn it back over to Michelle here, and we can open up for questions if anyone has any questions.
Yes, so big thank you to Laura for the presentation. It's wonderful, and I hope that we are able to gain a lot of valuable information. And yes, so we will move on to the questions.